In this lecture at Medical Sciences, we're going to look at regulation of thyroid hormones. We want to see how the thyroid hormones, that is T3 and T4, are regulated in the body. Then after looking at that, we are going to look at the disorders of thyroid hormone. And the regulation of thyroid hormones is by negative feedback mechanism. So we're going to look at negative feedback mechanism. Negative feedback, whereby we are going to see what triggers this hypothalamus anterior pituitary thyroid axis, because we are going to have here hypothalamus. This is hypothalamus. Then we are going to see the interplay of anterior pituitary gland. Then this is the follicle of the thyroid gland, what we call follicular cell with the tuboidal epithelia. And this thyroid gland, this follicular cell of the thyroid gland, is having a TSH receptor. And the regulation begins, or it is triggered by low levels. If we have low levels or decrease of T4 and T3 in blood, low levels of T3 and T4 in blood is detected by hypothalamus. So this hypothalamus is going to detect the low levels, and after detecting that there is low levels of T3 and T4, which we call hypothyroidism, we can call it hypothyroidism, it is going to trigger or to stimulate. It's going to stimulate the hypothalamus to synthesize and secrete thyroid releasing hormone. So this hypothalamus is going to synthesize and secrete thyroid releasing hormone, and this thyroid releasing hormone produced in response or due to stimulation of hypothyroidism, low levels of T3 and T4 in the blood, it is going to be transported to the thyrotropes. Within anterior pituitary gland, we have cells known as thyrotropes. And these thyrotropes are the one that are going to be the target site for thyroid releasing hormone. And after thyroid releasing hormone binding on the thyrotropes within the anterior pituitary gland, they are going to stimulate the thyrotropes to synthesize and secrete TSH. So these thyrotropes are stimulated to synthesize and secrete thyroid stimulating hormone. And when they secrete this thyroid stimulating hormone, it is transported in the blood, and it has the receptors on the follicular cells. So the TSH comes and binds on the receptor on the follicular cell of the thyroid gland, and this TSH, after binding on the follicular cells receptor, these are the TSH receptors on the follicular cell, after binding, it is going to stimulate the follicular cell of the thyroid gland to synthesize and secrete T4 and T3. So, and remember what had triggered was low levels. So, because there was low levels of T3 and T4, the main aim is to increase the T3 and T4 in blood. So that's why we see low levels triggering the hypothalamus to to synthesize and secrete thyroid-releasing hormone, which goes to the thyrotropes and stimulates the thyrotropes to synthesize and secrete thyroid-stimulating hormone. And after thyroid-stimulating hormone being released by the thyrotropes of anterior pituitary gland, it is transported by blood and binds on the receptors on the surface of the follicular cells of the thyroid, hence stimulating the follicular cells of the thyroid to synthesize and secrete T4 and T3. And if it continues binding, it is going to reach a point whereby it is going to cause levels of T4 and T3 to go high. And when the levels of T3 and T4 and T3 increases, which we call hyperthyroidism, this one we call it hyperthyroidism, that is increased levels of T3 and T4. This increase is still going to be detected by hypothalamus and is going to go and inhibit, the hypothalamus from further release of TRH. So it is going to inhibit the hypothalamus, at the same time inhibits the thyrotropes. So it inhibits both the hypothalamus and the thyrotropes to stop producing TRH and TSH. Hence, T3 and T4 will go back to normal. So this is what we can talk about regulation of T3 and T4. In summary, we are saying when there is low levels of T4 and T3, it triggers the hypothalamus to synthesize and secrete TRH, thyroid-releasing hormone. And this thyroid-releasing hormone goes to the thyrotropes within anterior pituitary gland, which secretes thyroid-stimulating hormone. And this thyroid-stimulating hormone, it goes to the follicular cells of the thyroid, and it is going to stimulate the thyroid to synthesize and secrete T4 and T3. And we are saying when T3 is produced and reaches a point whereby it goes beyond normal, the high levels of T4, T3 and T4 are going to be detected, and they are going to come and exert the inhibitory effect, whereby increased levels of T4 and T3, they come and exert the inhibitory effect on the thyrotropes and inhibit further production of TSH. As if that is not enough, they go ahead and also inhibit further production of TRH from the hypothalamus. That is what we can discuss about. So in other words, we are trying to mean that low levels of T4 and T3 triggers increased production of TSH. It will at the long run increase. Then increased levels of T4 and T3, they are accompanied with low levels of TSH. This is also what we shall see under result interpretation at the long run. So after understanding the regulation by negative feedback mechanism, that is hypothalamus, pituitary, thyroid axis, now this one is going to lead us into thyroid disorders. And if you haven't subscribed, please, we urge you to go to the subscription button and subscribe. Then you can like the video if you're enjoying. So in this session, we're going to look at thyroid disorders or thyroid diseases. And one of them is what we call hyperthyroidism. But before we begin that one, we can begin with goiter. It is what we call goiter. That's number one. whereby goiter is enlargement. It is an enlargement of the thyroid gland, enlargement of thyroid gland. That is what we call goiter, whereby you find the thyroid gland, which is found in the neck region, anterior to the oesophagus, is enlarged. That is what we are calling goiter. And this goiter can be either toxic goiter or non-toxic, whereby toxic goiter is accompanied with high levels of T4 and T3, whereas non-toxic is accompanied with low levels of T4 and T3. So toxic goiter is due to hyperthyroidism. Then non-toxic goiter is due to hypothyroidism. So we are saying that both hyperthyroidism and hypothyroidism can lead to enlargement of the thyroid gland. So that is goiter, which is enlargement. Then from there we can look at the second disorder, which is hyperthyroidism. Hyperthyroidism, which is characterized by increased levels of T4 and T3 with low levels of TSH. That is hyperthyroidism. But at the long run, during our further discussions, we shall differentiate between primary and secondary, whereby we shall tell you that this type of hyperthyroidism, this is primary hyperthyroidism. But there is also what we call secondary hyperthyroidism, which we shall discuss in our upcoming videos. So hyperthyroidism is increased levels of thyroid hormones, that is T4 and T3. And what are the causes? The leading cause of hyperthyroidism is Graves' disease. Graves' disease is the leading cause of hyperthyroidism. So we are saying this is the common cause, whereby this Graves' disease is an autoimmune disorder. This is an autoimmune disorder whereby your own body is producing autoantibodies, which resemble TSH. So we can call them TSH autoantibodies. And these autoantibodies, they act long, whereby they can act for greater than 12 hours. So when these autoantibodies come and bind on the TSH receptor, they continue to fire the production of T3 and T4, leading to hyperthyroidism. So Graves' disease is an autoimmune disorder producing autoantibodies resembling TSH, which go and bind for a long time on the follicular cells, then commanding longest production of T3 and T4. And we have said it is the most common cause of hyperthyroidism. Another cause apart from Graves' disease is thyroid adenomas. Thyroid adenomas, or you can call them tumors, can also cause, whereby the thyroid has tumors that continuously or progressively produce tetraiodothyronine and triiodothyronine, that is T3 and T4. So Graves' disease, thyroid adenomas can bring about hyperthyroidism. And even this is for primary, but for secondary hyperthyroidism, if it is secondary, we can also see tumors of the brain or any tumors of the affecting the pituitary gland. Tumors of the pituitary gland can also cause hyperthyroidism by producing much TSH, which TSH can also lead to overproduction. So if this is the tumor of the pituitary which causes secondary hyper, the results you find that is in both increased T4, T3, accompanied with increased levels of TSH. This is what we call secondary hyperthyroidism. But these first two are the causes of primary hyperthyroidism. So that is what we can note. So if it is the primary, it is increased T3 and T4 with low TSH. But in the secondary, it means the cause is not the thyroid, but the problem is with the anterior pituitary gland. Then from that we can look at the third disorder, which is hypothyroidism. Hypothyroidism. But before we go to this third disorder, we can look at the signs and symptoms. Signs and symptoms of hyperthyroidism, which include or which involves this one. One of the signs and symptoms is weight loss. There is weight loss. There is diarrhea due to increase the GIT motility. We see diarrhea. We see among the signs and symptoms heat intolerance. There is heat intolerance as the sign. So people with hyper, they are always feeling burnings within their body. So the body there is much production of heat due to high temperatures. Then there is also sweating. They experience night sweatings. Then there is also, apart from this, we can see they suffer from what we call amenorrhea if they are females. There is amenorrhea or sometimes oligomenorrhea. These are some of the signs and symptoms of hyperthyroidism. So after looking at this, we can look at the last one, which is hypothyroidism. And hypothyroidism this is low levels of T4, T3, accompanied with high levels of TSH if the cause is the primary hyper, if the defect is the thyroid gland. So if the effect is the thyroid gland, we have such a result. So if the problem is with the thyroid gland, you find there is increased levels of T4, T3, decreased levels with high TSH. But if the cause is secondary, we shall also see it. So hypothyroidism is reduced levels of T4 and T3. And the most common cause, of hypothyroidism is iodine deficiency. Iodine deficiency is the leading cause, the common cause of hypothyroidism. Then another cause of hypothyroidism can be Hashimoto's. It is an autoimmune disease which is called Hashimoto's thyroiditis. Thyroiditis. This is also an autoimmune disorder. This is an autoimmune disorder whereby the body is producing autoantibodies, and these autoantibodies are directed to destroy. They destroy the follicular cells of the thyroid. That is what happens. So the body producing antibodies against cells of self, that is Hashimoto's. And when the follicular cells are destroyed, of course, we shall no longer produce enough T3 and T4. And even iodine deficiency, because in the manufacture, we need iodine as a component. And this hypothyroidism, I can say note or NB that hypothyroidism in children, it leads to a condition known as cretinism, which is stunted growth. So you find these children, because we saw one of the function of thyroid hormones is for growth. So in children, it can lead to cretinism. Then in adults, it leads to myxedema. In adults, it causes myxedema, whereby this myxedema is characterized by swelling of the face and the lower limbs. So you find someone is swelling on the lower limbs and the face. This is what we call myxedema in adults, whereas cretinism is in children. And among the signs and symptoms, of hypothyroidism, the signs and symptoms, among the signs and symptoms of hypothyroidism include, there is cold intolerance, whereby someone, every time they are feeling cold, it is what we call bradycardia. It is bradycardia, that is decreased heart rate. There is what we call constipation. There is hoarseness of sound, of voice, Then constipation is there. Then there is even hair loss. Hair loss is also a characteristic or a sign of this hypothyroidism. Then these people can also suffer from what we call irregular menses. We have irregularity in menses. And this one is characterized by increased levels of prolactin, increased levels of MCV, so someone can suffer from what we call macrocytic anemias. Macrocytic anemias can also be there. So this is what we can discuss in this session, where among the thyroid disorders we have looked at goiter, we have looked at hyperthyroidism, and this hyperthyroidism, another name you can call it thyrotoxicosis. toxicosis. Then we have seen the leading cause is Graves' disease. Then the leading cause of hypothyroidism is iodine deficiency, together with Hashimoto's thyroiditis. And we have said in children it leads to cretinism, whereas in adults myxedema, that is swelling of the face and the lower limbs. And don't forget that this Graves' disease is characterized by protrusion of the eyes, whereby the condition is called exophthalmos. So if you meet someone with whereby the eyeballs are almost going out, that is what we call Graves' disease. So it is characterized by protrusion of the eyes. That is what we call Graves' disease. Then we have also seen about signs and symptoms of hypothyroidism. Thank you so much for learning with us. May God Lord bless you.